Let's talk about menopause. Hi and welcome to the first of a few short videos on menopause. My name is Dr Mandy Deeks and I'm a psychologist with over 20 years experience in women's health. One of my areas of special interest is menopause. 17 years ago I completed a PhD looking at things like the impact of menopausal symptoms on women's lives, mood and menopause, body image and menopause, relationships and sex and menopause, and role and purpose in life around menopause. I interviewed many women and I sent even more women a lot of surveys asking all about their experience of menopause. I will say from the outset, the women who took part in my study were amazing. They shared their most intimate thoughts and symptoms with me and I learnt so much. It really was a privilege to be let into their lives and hear their stories. I will always remember one of the first women I interviewed, who said the day of our interview she had been thinking about what it is like to be menopausal and a bit older. And she'd been walking past a construction site on her lunch break. She said she suddenly felt invisible. When she was younger, she cringed when she'd been whistled at, but now, and she said, I know how wrong this is to say, I would just like to be noticed. Another woman told me it was the best time of her life. She said she'd spent her years caring for everyone else and that now was a time for her. She had the time and space to focus on what she wanted to do. That was in the late 1990s. I can't believe it was so long ago. But I think we talked about menopause more back then than we do now. I think there are a few reasons for this. A lot has actually changed in the 20 years that I've studied menopause and been counselling women through their menopausal years. When I first started my PhD, I asked women about the empty nest because most women had adult children who were leaving home, they stayed out of the home, they got married, they had their own children, and I asked women about grandchildren. Now, some women have adult children, some are living at home or they've left and they've come back, the boomerang kids, but even more common are women who have 10-year-olds and teenagers in the house. So at the same time women are experiencing changing hormones, so are their children. You have menopause and puberty in the same household. There isn't really that much time to talk about menopause. There really isn't that much time to think about it. And in 2002, the menopause world was changed by a study that said hormone replacement therapy, or HRT as it's often abbreviated to, was linked to increased rates of breast cancer. Women stopped taking their HRT, some overnight, and doctors struggled to know how to help women who had menopausal symptoms. I remember seeing women who were confused, upset, distressed, suffering terrible hot flushes, sleepless nights, and they really didn't feel like they knew up from down. Gradually, we've learnt more about that study. We found the information was based on women who were much older than those who usually take HRT. They were in their 60s, and menopause usually happens around 50 to 51 years of age in Western societies. That is the time that some women need HRT for a short time to help with symptoms. The trouble is, many women now stay silent if they're on HRT because it's not the done thing to do. Now, I'm not saying that HRT is the answer to all menopause symptoms. It is only one of many treatments that women might try to help them through this time. And for some women, HRT is not right at all. The bottom line is we have all seemed to have gone silent on menopause, whether it's the HRT studies or our busy changing lives or women at different stages. Perhaps we don't want to talk about such personal things when so many other things seem to take priority. Whatever the reason, it would be really good if we started talking about menopause again. It is a wonderful time to reassess our health. And more women who I speak to are suffering in silence. They'll often say to me, I don't know if this is even menopause. but I'm having all these symptoms and I just don't feel myself. Some nights I can't sleep, some days my anxiety is worse and there's no reason. Sometimes I'm just hot, and not in the young hot way I used to be when I was younger. They say, we might joke and laugh about hot flushes with girlfriends, but it's hard to know what's really going on and whether we should do something about it. And they don't know who to turn to for information and help. That is why I recently updated a book on menopause that I wrote over 10 years ago. More Than Menopause is a guide to all that happens around menopause for women. And there's also a chapter for men to read so they can understand menopause. If you would like to have a quick peek at the book, go to Amazon and search for More Than Menopause by Mandy Deeks. You may also like to look out for some of our other videos on topics such as what is menopause, what are the symptoms of menopause, what is the emotional impact of menopause, and what about workplaces and menopause. But for now, take care of you and maybe choose one small thing you can do to be healthy today.